Hi, I'm Scott Green. I'm a family physician here to talk about the COVID vaccine and the recent COVID surge. I'm going to read my comments today because I want to communicate clearly and efficiently. I daily address questions about the COVID vaccine from my patients and family and friends, and this is an extension of those discussions. At the beginning, let me share my appreciation for our nurses who have sacrificially staffed hospitals and offices during this time. Nurse practitioners and physician assistants who have provided much needed primary and specialty care, and the many primary care physician colleagues who have also stepped up to answer the call of caring for patients in the hospitals and offices in the midst of the worst pandemic in over 100 years. I'm a board-certified family physician with 31 years of primary care experience. What I'm going to say next, I believe to be really important. While these medical personnel I've just listed, myself included, have a role to play in caring for patients in this pandemic, none, and I mean none, of us are qualified to speak with expertise on the development and implementation of the COVID vaccine in the setting of public health. However, we are qualified to share information articulated by people with expertise, medical scientists and researchers in the fields of immunology, virology and infectious disease, epidemiology, and public health. These experts are the ones who oversee studies and produce data upon which recommendations are made. I would not expect you to believe anything I or anyone else says that doesn't have medical scientific data and the interpretation of people with expertise to back up their information. The majority of these experts work for medical institutions that do research, institutions that you may have heard of like Johns Hopkins, Harvard, or Stanford universities, the Cleveland and Mayo clinics. They design studies to address particular questions, and then they apply for grants from the government or other private or nonprofit entities to resource the studies. Once done, they're often presented to the medical and scientific communities for peer review and evaluation, and then published in reputable sources like the New England Journal of Medicine. Some of this role is served by the National Institutes of Health, the NIH, which receives government funding to help provide grants to institutions and medical scientists. They help evaluate and communicate this data to others who are also doing research, as well as the public. I would also note that the NIH is overseen by Dr. Francis Collins, one of the most brilliant scientists in the world. He led the team on the Human Genome Project, which mapped the entire human genetic code. In addition, he's a committed Christian man who has not only been clear about his faith, but leads national discussions about the intersection of faith and science, and is known throughout the medical world and the government as a man of integrity. I would also mention the role of the Centers for Disease Control, which brings together many of the brightest minds in the realm of epidemiology and public health, working together with state and local health department officials to interpret data and address the impact of disease on society, from the local level to its implications internationally. The information I'm providing today is filtered through this process of high-quality research by reputable institutions and scientists, demonstrating evidence that is evaluated by expert peer review for accuracy and published for broader use. One of the reasons I start with this whole discussion is clear. Where we get our information matters. There are many in the medical profession, unfortunately, who are speaking well outside their area of expertise. But because they're part of the medical community, lay people without such background become confused about who or what to believe. There is much misinformation and disinformation circulating about the COVID vaccine and COVID management. Most of the medical decision-making we provide in all aspects of medicine is based on this same scientific method, research overseen by people with expertise. As good as some of our GI specialists are, we would not want them managing our heart attack in the emergency room. So, to some of the latest questions and concerns I'm hearing. Can the vaccine affect fertility for young women, or can it adversely impact pregnancy? There's no evidence that either of these are true. In fact, just this past month, the American College of OBGYN and the Maternal Fetal Medicine Society have issued recommendations for pregnant women to get the vaccine because studies showed it was significantly less risk to the mother and child than to be unvaccinated and get COVID. Does the mRNA vaccine somehow change our DNA? Isn't the mRNA vaccine technology new and not adequately studied? The answer to both questions is no. The mRNA technology leading up to the vaccine has been in development for at least 10 to 15 years and has been known about for decades. The researchers were prepared in such a way that when COVID-19 showed up about 18 months ago, they were ready to develop a vaccine for it. And because of unrestricted government funding and staff support, they were able to do so quickly. Is the vaccine effective? Yes, it is one of the most effective vaccines in history. Remember, the design of an effective vaccine is not to completely prevent disease, but to minimize severe case that would result in hospitalization or death, as well as reduce the likelihood that you could pass the disease on to someone else. Using both of these criteria, it has been very successful. Now that we have two large groups, one vaccinated and the other not, we can see its benefit. In the past 6 weeks, over 97% of hospitalizations from the Delta variant have been among the unvaccinated and undervaccinated populations. And researchers have concluded that 89% of COVID deaths in just the last month could have been prevented by vaccination. What about COVID in children? There's been a substantial increase in pediatric hospitalizations in the past month, primarily from the Delta variant, which is much more contagious than the initial strain was. More kids have been hospitalized each day in the past week than at any time since the pandemic began. The hospitalization rate is approximately 2.5% of those infected for kids in Indiana in the past 6 weeks. Also of note, the vaccination rate for Indiana is just under 50%. Aren't COVID hospitalization numbers inflated because many are hospitalized for another illness but just test positive for COVID? No. Of the number of people in the past 6 weeks who've been admitted to the hospital in Indiana and have a COVID diagnosis, only 0.4% were admitted for another diagnosis but tested positive for COVID. 99.6% were admitted because of their COVID illness. Can a person be hospitalized or die from COVID after getting vaccinated? Unfortunately, the answer is yes. The cause is primarily a small number of people whose immune systems don't fully respond to the vaccine. People who have immune suppression should get the vaccine to mount what response they can, but it becomes just as important, maybe more so, for the people around them to be vaccinated and mask appropriately to reduce the likelihood of transmission. What about the long-term risks of the vaccine? Vaccines have been studied in depth now for over 75 years. The manner in which they elicit an immune response and create the potential for side effects, both short and long-term, is well known. There has never been a vaccine that's been shown to cause long-term side effects that didn't manifest in the first 6 weeks after vaccination. This is why the studies on the current COVID vaccines were at least 8 weeks long. And since we now have months of close observation and hundreds of millions of doses, more than any vaccine in history in such a period, the experts tell us with confidence that there have not been and are not likely to be any long-term side effects with COVID vaccines. On the other hand, being infected with COVID has a much greater incidence of long-term ill effects. Initial study estimates of what has been called long COVID suggest that between 10 and 20% of people aged 35 to 65 have symptoms that last longer than 12 weeks. More studies to clarify these long-term effects are ongoing. Is there information about the vaccine being hidden from the public? Is there something that someone knows that they're not telling us? With all the confusing information put out on social media, this concern is understandable. All I can say to this is that all 6 living presidents, 4 Democrats and 2 Republicans, got the vaccine. Almost the entire Congress, the Departments of National Defense and the Department of Intelligence, the leadership in all of the medical science community, all have received the vaccine. Current estimates are that 98% of all physicians in the United States have received the vaccine. If this group of people doesn't know if something's hidden from us, I don't know who would. I understand the questions I've addressed are just a few of the many that people have. If you have other questions, please consider jotting them in the contents section following this video. I'm glad to answer or research any answers to questions you might have. I intend no judgment or shame on anyone. I just want to make sure that any who may be listening have an opportunity to be heard and have someone compassionately and clearly answer questions on the basis of the best information from the best experts. Please consider the vaccine if you've not received one. All available scientific evidence to this point points to the risk of the vaccine being so much less than the risk associated with the COVID infection, both for you and the people around you. Blessings.